Hello, Women's Advantage Men's Optimal Health community. My name is Sarah Pizzi, and I am joined by Dr. Sarah Shemanek, and we are physical therapists at Women's Advantage. And today we are joining you to talk about physical therapy role in treating patients that have endometriosis. So I'm going to first pass it off to Sarah, and she's going to talk a little bit about our role.
Thank you, Sarah. So physical therapy is one part of the treatment for endometriosis that typically is going to involve several different practitioners, an endo specialist doctor, often psychotherapy, nutritionist, maybe acupuncture, some different things that are all going to be kind of part of the holistic treatment for endometriosis. And what our part of that role is to help you almost partially as a coach to learn strategies to minimize flare-ups and pain, help you be independent with symptom management. So when things do come up, when you do have a flare in the endometriosis symptoms, that you know how to manage that and what to do, and to really also help prevent maybe some of those flare-ups by knowing how to best help your body to deal with that. So our role is not just in some of the exercises that we do, but also in education for the individuals with endometriosis, guiding you to resources and providers and things like that. In actual physical therapy sessions, if Sarah can go to the next slide for me, we will typically involve an individualized exercise program that's specific to you, could involve some myofascial mobilizations, particularly self-treatment techniques, again, helping you to know how to manage those flares on your own. And then exercises can be often some combination of things for mobility and things for stability, right? Which are both of the things that we really need for a good, healthy body. So things like stretching, calming down the nervous system, and also strengthening, so we have more strength and support around our organs and our joints and our bones, which can really help with movement. So also movement strategies, posture, all of that is all part of it as well. Anything else to add there, Sarah, that I'm missing?
No, I think that was good. So I will
move
on. And so Sarah talked a lot about the education side of things that as physical therapists that we have a big role in with all of our patients, but especially in our patients with endometriosis, that this really affects a lot of different systems throughout the body. And so it's really important to make sure that a lot of our basic health needs are met, so that our body can focus on what is truly important. And so I'm going to go through a few of the pieces that I take a lot of my patients through, and I know a lot of us therapists that work with this population will talk about with our patients. So the first is sleep. Sleep is very important. It's our time, our body's time to help to obviously rest, but also to heal. It's a great time for our body to relax and to reprocess the day that you just had and get ready for the next day. So a lot happens during sleep, so it's very wise to try to be getting at least your 8 hours of sleep. But realize that your body may need more depending on what you're going through at that time, if your body needs that rejuvenation stage. So making sure that you're getting plenty of sleep is important. The next is a big one, is nutrition and hydration. So for the nutrition, there are a lot of resources we'll talk about in a minute to help with that, but making sure that one has a very balanced nutrition to make sure they're getting all the nutrients and vital elements that are important for good health. And sometimes nutrition can also help, or I should say, can mean a change in your nutrition, because sometimes our symptoms might get worse with certain types of foods. So I think it's really important to try to find somebody, whether it be somebody like a functional nutritionist, a naturopath, or a functional medicine doctor that would be able to help you understand your nutrition and what is right for you, because one person's ideal nutrition might be different than somebody else's. And then hydration, really important. And I will give a little plug for our hydration challenge, because right now our clinic is challenging our staff and our community in making sure that they are getting proper hydration. What that looks like is ideally half your body weight in ounces. So for example, you weigh 120 pounds. Ideally, you want to try to get 60 ounces of water in. And so we're challenging everybody this week from Monday through Friday to try to meet that goal each day. And if you're seeing this in the last week of March, start of April, that you can tag us on your social media. So join us in the challenge and post it on social media and tag us in it, so we can really raise more awareness for how important hydration is. So also very important with our patients with endometriosis. Stress management, we do a lot of breath work in pelvic physical therapy, and not only is it going to help with regulation of our nervous system, but it's also really important for relaxation of muscles, for regulation of pressure, and for our muscles' vital functioning. So stress management and breath work is also really important, and it's good to try to get some time carved out in your day to work on these things. Movement and exercise. I think it's obviously in physical therapy, we're going to prescribe certain ones that are best for the individual. However, just understanding how important daily movement and exercise is to help make sure that we're preserving our joint mobility, our strength, our cardiovascular function, and it also can help a lot with things like stress and different mental health states. Toileting habits is our last one, and this is also one that I'm sure a lot of us pelvic health therapists hold dear to our heart, is how important it is to have good toileting habits. So making sure that you are urinating a good amount during the day, meaning usually between 5 and 7 times is ideal, depending on the person, and every 3 to 4 hours. So making sure that you're not going too little and you're not going too much, and we can help you with that if necessary. And then in terms of bowel movements, making sure that you're trying to get at least one bowel movement a day is ideal. I think especially if with endometriosis, there's often some bowel considerations into symptoms. So I think it's good to make sure that you're getting regular, non-straining, and good consistency bowel movements. So soft but forms is ideal. So those are the basic pillars of health. So it's important to know that lots of these things might require little daily health changes and health habit changes, but you might not be able to do it all at the same time. That some of these things you might need to look and see what you already are doing quite well with and what kind of things you might need to start changing, and set yourself up small goals. If you have a therapist or anybody on your health team, you can ask what might be a priority or what order you should be trying to prioritize things in. I think it's important to make sure that your goals are achievable and they're manageable. So we're always happy to help with that. So I just wanted to make sure that we highlight some of the groups that if anybody of you watched our interview with Dr. Iris Orbach a few weeks ago, that she did highlight some resources for people with endometriosis. So the first was a documentary called Endo What? And then there's the Endometriosis Summit, which is intended for anybody with or treating or supporting people with endometriosis. And so the Endo Summit is once a year, and if you go to that website, there is a load of good information on there in the treatment and living with endometriosis. And then Nancy's Nook is a great support group that there is a Facebook group. There is also a website that is also full of good information. If you are looking for a skilled endometriosis excisionist, that they do have a list of doctors that have been vetted as a skilled excisionist. So you can look on Nancy's Nook for that link. And then lastly is a couple of books, both Beating Endo and Outsmarting Endometriosis, that are great references for people living with and people assisting women with endometriosis. So you can find those for good resources and for a lot more information on what might be helpful to live your best life with endometriosis. So I'd like to thank you all for joining us for this conversation on physical therapy's role in endometriosis. And I hope that those of you watching got some good information out of it. Next, look forward to our next couple months. We're going to be looking into both breast cancer and prostate cancer rehabilitation. So please stay tuned for more research and interviews and question and answer sessions in the future. All right, and thank you, Sarah, for joining me. And we will see
Thank
you.
you.
All right, bye-bye.
Bye-bye.